move on to the posterior crural compartment is that the posterior crural compartment upper part is a part of the popliteal fossa. So popliteal fossa has a floor, so it was bounded by the medial and the lateral head of the gastrocnemius along with the plantaris. So as we remove this, we find these are the femoral condyles, right, and the tibial surface, the tibial condyles. Now this particular muscle we already know, medial and the lateral head of the gastrocnemius. So this is the entire gastrocnemius removed. This muscle is the soleus. This particular muscle is the soleus. And this is basically the attachment of the soleus along the soleal line. So it's like the sole of a foot. This is like the toe, these are like the fingers. So there is a curved line, and above that curved line you find this triangular area. See, out here you are able to see a muscle which is called as the popliteus. That's why we say that the floor of the popliteal fossa is formed by the condyles along with the popliteal muscle, right? Now, as we are into the posterior crural region, here we have found, just as this is the gastrocnemius, this is the soleus, and if we join these two, we get a muscular mass here which is referred to as the triceps suri. If we progress downwards, this triceps suri continues as a tendon known as the tendocalcaneus, also the tendoachilles. We go deeper to this. We have cut through the soleus, and now what you are able to see is the tibial nerve. These are basically the branching of the tibial nerve that will basically go and supply all these muscles. And here you also find accompanying the tibial nerve are the tibial vessels. Primarily the centrally thick structure is the tibial artery. So this is basically present on the posterior compartment, so we call this as the posterior tibial artery, but the nerve is referred only as the tibial. Now here we are finding, yes sir, this is the deeper plane of the posterior crural region. Here we find primarily three muscles. One muscle on the lateral aspect, because we know this is the lateral side, so this is the fibula. So this particular muscle that is attached to the lateral bone is the flexor hallucis longus. This particular bone is the tibia, which is basically the medial bone. So this particular muscle is the flexor digitorum longus, and between these two we have found this particular muscle which is called as the tibialis posterior, and we have already seen this. So that basically brings us to the end of the posterior crural region. Now once we have seen the posterior crural region, we can actually go here. Though the dissection, this body is a bit dried up, this one is our tendocalcaneus. Here is the medial malleolus. So structures that are moving from medial to lateral, first is this medial most structure. This one is the tibialis posterior tendon. With it coming lateral to it is the the flexor digitorum longus. Then we have the tibial, that is the posterior. This is the nerve, right? You can actually understand this is the nerve. And here you will get the posterior tibial artery. It's actually dried up, so it's a bit difficult, but you can actually see it is accompanying it. Okay, so this is the artery and this is the nerve. Okay, so it is talented doctors are never. And finally you find this tendon, this thick tendon. Okay, so this is the tendon of the flexor hallucis longus. These are basically the structures that are present between the medial malleolus and the tendocalcaneus. So basically the structures are moving from medial to lateral. Tibialis posterior, followed by the flexor digitorum, followed by the posterior tibial artery, followed by the tibial nerve, and then we have this thick structure that is the flexor hallucis longus.
Lateral peroneus.
Calculate tulish. Okay. Now if we move to the lateral aspect of this, okay, we are just trying to move to the lateral aspect of this. So here lies the lateral malleolus. Here lies the tendocalcaneus. Here we are able to see two tendons. One tendon superficially and another tendon on the deeper plane. This particular tendon which is present on the superficial aspect, this is the peroneus longus, and the tendon which is present in a deeper plane, this one is the peroneus brevis.
that brings us to the end.